On this edition of MTA's Commuter Connections, a look at some of the important life-saving efforts of the University of Maryland's health system in breast cancer awareness. We've also got an update on the proposed Red Line transit service, and we'll answer some of your questions on the Ask the MTA segment, all here on MTA's Commuter Connections. Welcome to MTA's Commuter Connections. I'm Greene, and for this edition we're on location at one of the University of Maryland's community clinics. This one is located in Baltimore's Edmondson Village Shopping Center. For a number of years now, the University of Maryland Baltimore City Cancer Program has offered free life-saving cancer screenings to low-income residents in our region. Programs like this have made a world of difference in the lives of so many in our area. Joining with us with more on this program is University of Maryland community health educator Rhonda Boozer-Yearly. Welcome to the program, Rhonda.
Thank you so much for having me.
I'm extremely excited to be here, and I know about the important work you do here, so tell us a little bit about what this program is all about.
With the Baltimore City Cancer Program, we're part of the University of Maryland Marlene and Stuart Greene Cancer Center.
Okay.
We're the outreach arm of the Cancer Center, and we provide free breast and cervical cancer screenings as well as colorectal screenings to Baltimore City residents who are uninsured or underinsured. Not only do we provide the service, but if a cancer is found or if the patient needs follow-up service, we will pay for that as well. So we're not going to just diagnose the patient
and then just leave them there.
Send them on their way. So we're screening, we're prevention, we're education, we're treatment. We try to reach the patient holistically.
Now, how many years has this program been around? Because I have to tell you, this is an important resource in the community.
Unfortunately, I hear that a lot. However, we've been in existence since 2001.
Wow.
In that time frame, we have screened over 22,000 Baltimore City residents.
So they've come through here, accessed that free service, and really have taken advantage of that, of the treatment that's been offered here.
Absolutely.
Now, when you talk about the difficulties in diagnosing and treating breast cancer, and we all know that this is a huge issue in the African American community, you tend to give the follow-up also to these women that come here and access these services. So it isn't just getting the treatment, the medicine, there's a follow-up and maintenance. They can continue to access the services.
Absolutely.
Am I correct?
I think that oftentimes, you know, we need help, and that's African American, Caucasian, whatever the case may be. So we walk with the patient. We have case managers, we have community health educator, that's what I am, and then we have also community outreach workers who will walk with the patients through this entire process.
Now, when you talk about awareness, how is it that you conduct this awareness? How do you get people to pay attention to the things that they need to when it comes to their own bodies? You know?
Folks have heard me say this time and time again that we really do prostitute ourselves. We will go anywhere and talk to anyone, no matter the location, no matter the neighborhood, about the importance of early detection. Early detection means screening.
Saving lives and screening, yes.
Absolutely. So it means preventive care. It means going to get checked even if you don't feel something, even if you feel great, because you never know what may be. So we do churches, we do book clubs, we do larger events. So no matter how large or how small, we will go out and speak. And the blessing of it all is that it's free of charge.
And I think that's what people need to understand. This is a free program. People can, you know, it's one thing to do the breast self-exams at home, which I know you guys go out and you educate.
Absolutely.
But the next step is I see a problem, I feel a problem, I'm not feeling well. Getting over that fear and coming in.
Exactly. So we've got free on both ends. We've got free services that we offer as far as the medical care is concerned, and then we have the free education services. So it's a win-win situation.
And it is a holistic approach.
Absolutely.
Now, I noticed that even in walking through the facility, you have a wide variety of customers, of clients. I mean, folks of different ages, everybody's involved. So how do you get such a diverse population to come here? I mean, this is amazing.
Well, the Baltimore City Cancer Program is just a small part of University Care at Edmondson Village. We see patients here at University Care, adult sick and well care, children sick, well care, obstetrical, gynecological care as well as prenatal. We refer out, of course, if there needs to be any type of consult with a specialist. We've got mental health services here, so
Certainly.
we've got it all. We're in the middle of a shopping center.
And it's accessible with public transit.
Absolutely. Bus lines right out front,
Right.
so it's easy for folks to get here, easy to recognize.
I know that you all partner with other health providers across the region, and you also sponsor events. Can you tell us a little bit more about your outreach beyond just the communities, how you partner to spread the services and the word about what you do?
Sure. We, again, are part of University of Maryland, but we partner with other federally qualified health centers as the Baltimore City Cancer Program, so that we're not just seeing patients who live in West Baltimore.
Right.
So we partner with Baltimore Medical System, People's Community Clinics. We partner with Total Health Care. We're on the cusp of partnering with Chase Brexton so that we can see patients all over the city, because there are still a good number of city residents who don't have health insurance.
And in this economy, this is a vital, vital resource, which is why we wanted to talk to you today. People need to know about this service and about this program. Now, how do they get information? How do they reach someone here to say, listen, I don't have health insurance, I haven't had a breast exam or a pelvic exam in 3 or 4 years? How do they get in touch with you?
410-328-HOPE. That's 410-328-4673. Call. We'll do an intake, make sure that the patient is eligible for the program, and we'll get them moving and rolling as soon as we possibly can.
Is there a website also where they can find that information?
It is www.umgcc.org.
Okay, and so they can call, they can get the information, leave the fear aside, am I correct? Leave that fear and take charge of your health.
It sounds good, but yes, because it's not always as simple as leaving the fear aside, which is why I exist, part of the reason why I exist as a health educator, to try to walk people through the process.
So they're not alone in it.
Exactly. Fear is a big obstacle, so it's not always as easy as just getting over it and picking up the phone.
And I understand the University of Maryland, specifically your program, has partnered with Heart and Soul magazine. Can you tell us a little bit about your partnership with them?
Absolutely. We're excited to collaborate with Heart and Soul magazine on the Heart and Soul Awards weekend. It will be Friday, June the 17th and Saturday, June the 18th. On the 17th, we'll have a Women of Substance reception. On Saturday, June the 18th, we'll have the Healthy, Wealthy, Wise, and Beautiful Conference and Expo.
Like the way that sounds.
Which will be held at the University of Maryland School of Nursing. And then on that evening, we'll have the Heart and Soul Awards. The blessing, again, is that this is not just for Baltimore City residents, but it's a national conference. But of course, we want to make it available to our own. And for more information on that, www.heartandsoul.com.
Well, it's great to know that you guys are partnering with it and that we're going to have national recognition for some of the great things that are going on here in Baltimore. Well, it's a pleasure having you today.
Thank you.
And we look forward to seeing you again.
Thank you.
Up next, an update on Maryland's Red Line Transit project. Stay with us.